to talking about protection for intact nerves using the Axoguard nerve protector. And so, why even look at developing a nerve wrap? Well, recurrent scarring is a really common problem that can lead to pain and impaired nerve function for patients. And if the patient has had recurrent scarring, the surgeon may want to do something more than just freeing the nerve out of scar again. And there was also some precedent for using autologous tissues to protect nerves in these sorts of situations. But again, similar to autograft, there are some downsides. There can be donor site morbidity, there's limited supply, and some of the techniques can be really time consuming. So, prior to our Axoguard nerve wrap coming onto the market, basically there was vein wrapping. So this is where, they harvest autologous vein and they cut it open and then they wrap it around the nerve. But this can be a time-consuming technique. You need a second surgical site, so you can have all of the comorbidities that go along with that. And, it can just be, it's just an additional, can add additional time to the procedure. But it does, provide a barrier to scar tissue. Now, there's in carpal tunnel, a popular option is the hypothenar fat pad flap. And again, it does provide a barrier to the surrounding tissue, but it only wraps part of the way around the nerve. It doesn't provide full circumferential protection. And again, it can increase procedure time. And then, before Axoguard came onto the market, there were some off-the-shelf wraps available. But, some of these are semi-rigid. Some of them are made out, a lot of them are made out of collagen, and have all of the same issues we discussed with the collagen conduits. So we were looking to do something a little different. And that's really where we came up with, the Axoguard nerve protector and using this small intestine porcine submucosa. And again, just to really reiterate, the real differentiating factor for this material is that it does remodel into that new tissue layer. So you're going to have this permanent protective layer around the nerve compared to a collagen product or other synthetic product that's just going to degrade over time. And so, situations where the Axoguard nerve protector can be useful are situations in which the surgeon has had to do, an extensive neurolysis and has disrupted the epineurium, when they want to protect from soft tissue attachments. So things like revision decompressions or, for use in patients with a known propensity to scar, when surgeons want to protect the nerve from adjacent hardware, anytime you want to rebuild the epineurium, and even in partial lacerations, it's a nice way of helping to minimize axonal escape. And it can also be used in a manner similar to the connector at coaptations for minimizing tension.